welcome to the session of Stroke Awareness. I'm Aishwarya Singh. This initiative is in partnership with Boehringer Ingelheim to spread awareness about stroke. Today, we have with us Dr. Trilochan, Senior Professor and Stroke Specialist, SMS Medical College and Hospital, Jaipur. Welcome, sir. Thank you for joining us.
Thank you. Thank you very much.
So to begin with, stroke is something that is of very time essence. And what we would like to know, what is the basic understanding of stroke? What are the early signs that can be people can look out for, and why it is so important that you have to act very swiftly when someone is having we are witnessing any sign of stroke.
So basically, the stroke is like brain attack. I think everybody knows about heart attack because it is very common and it affects the vital organ of the body. As well as the brain is again very, very vital organ. So if any vessel or any blood supply to the brain is hampered, or if the blood vessels rupture, then the stroke occurs. So basically, stroke is type of brain attack equivalent to the heart attack. And the signs are usually there's a weakness of one side of the body. So either there's a right side of the upper limb, right side of the lower limb, right hand or right leg is not working. Sometimes the face is deviated. Sometimes there's a difficulty in speaking. There's a difficulty in seeing, or there's a problem in the vision. So all these problems are the indicator of stroke.
So just when we talk about stroke, how lifestyle plays a role in that, in preventing the stroke?
Yeah, the lifestyle is very, very important for the prevention of stroke. All the factors which are contributing to the heart attack are the same factors which contribute to the stroke or brain attack. So these factors are hypertension, diabetes, and smoking. So these three are called major risk factors for the stroke. So as we know, the hypertension and diabetes are mainly lifestyle diseases, because if lifestyle is not good, definitely you are going to develop hypertension or high blood sugar. And the smoking is again one of the modifiable factors, which if you stop, definitely then the chances of stroke become less. So if you have a control on the hypertension, control on the sugar, and if you quit smoking, these are the three important factors by which you can prevent the occurrence of the stroke.
Absolutely. So, are there any gender specific or age groups that are more at higher risk of stroke?
Yeah, usually the strokes are more in the older people, those who are more than 60 or 65 years of people. So usually it is disease of older people. But now, as India has more younger population, the heart attack as well as brain attack or stroke is more common in the young people because of unhealthy lifestyle. Because we know that lifestyle is not very good, our food is not very good, and our lifestyle as well as our food is contaminated. We have a lot of stress, even the younger population. So stroke is also increasing in younger population. Regarding gender, before the menopause in the woman, the chances of stroke is less because there's estrogen hormone which prevents stroke as well as heart attack. But as the estrogen effect goes after the menopause, then the stroke incidence is equal in the man and female women both.
And does family history, the genetics part, what kind of role does they play in?
Yeah, exactly. So second factor, along with your lifestyle, bad lifestyle, is the genetic factor. Hypertension and diabetes in around 40-50% of cases is genetic. So if your father, your grandfather, your uncle has history of diabetes or hypertension, chances of having hypertension and diabetes is more. And because these are the main culprit agent for producing a stroke. So the main factors of genetic factors which are contributing to hypertension as well as the diabetes are responsible for occurrence of the stroke. As well as in some of the patients, there is some genetic abnormality which runs in the which is the hereditary problem, which is also produces the stroke.
So you talked about how hypertension and diabetes are like major risk factors in stroke. So how these managing these chronic diseases can help in to what extent they can help in preventing stroke?
They are very helpful. I would say these are very much modifiable risk factors. So if you even if you have hypertension, even if you have high blood sugar, don't worry about it. If you have a regular medicines, if you do regular exercise, and if you control blood pressure and sugar with the effective medicines, then the chances of stroke become very, very less, as well as heart attack also become very less. So diabetes, hypertension, as well as the smoking, these are the three factors. If you control, they are very helpful in preventing the stroke.
Absolutely. So, since people are majorly reluctant, for regular checkups and all, do you think, or how important it is that, these screenings are in preventing strokes?
I think screening is very, very important because most of the time in our hospital or in our emergency, we see that patient is admitted with stroke, and at the time only he is diagnosed with hypertension or diabetes because there is no regular checkup. And as we know, in our country, particularly in the rural population, the routine checkup is very, very less. So they are diagnosed heart attack or stroke at time of when they develop. So if there's a regular screening and if you do control at the diagnosis level, these hypertension and diabetes, definitely it is stroke is very much preventable.
So, generally, blood thinners are taken as medications. Uh, do they play a role in preventing stroke?
Yes, blood thinner has role in the preventing stroke, but it should not be routinely given. So it should be given only those patients who has already had minor stroke or major stroke or who has heart attack. So those patients who have heart attack or already history of stroke, then it is helpful to prevent further stroke or further heart attack. Otherwise, routine recommendation to even hypertensive or diabetic patient, the aspirin is not recommended because aspirin has own its side effect. The main side effect is the hemorrhage in the stomach. So it should not be taken as a very casually. It should be taken on the advice of the doctor. Otherwise, they may have the side effects also.
Definitely.
Yeah.
So, when it comes to prevention, community education is vital. What are your views on that?
Yeah, community education is very much important because, as I said, the most of the stroke factors are modifiable. So if you modify these factors at the community level, so if you have a regular screening of the hypertension, a regular screening of diabetes, if you have a at the community level, you have good communication to the people that is smoking is very, very dangerous for your heart and brain, then it is very going to helpful. The another important factor for the stroke as well as heart attack is the increased cholesterol. So if you have a high cholesterol, then your blood vessels get blocked. Either it is a heart vessels or brain vessels, and then you get the stroke. So if you have a good cholesterol control at the community level, so say that your diet is modified, you're having a low cholesterol diet, you do regular exercise, then it is very, very important we can prevent the stroke at the community level.
Definitely. When we're talking about stroke prevention, it is very important that stroke rehabilitation recovery is also considered as the important aspect. So,
Yeah.
what are the key rehabilitation therapies for stroke patients and how do they aid in recovery?
Yeah. First, we should know that stroke is third most common cause of disability. So, if you have a stroke, there's a very high chances that you have disabled. You may be bedridden, or you may be chair-bound. So, around 50% of the patient recover, but the 50% of patients may have some kind of disability. They have difficulty in walking. They require a stick to walk. They require walker to walk, and some are chair-bound, and some are bedridden. So in
Right.
these patients, those who have not completely recovered from the stroke, the rehabilitation is very, very important. And this rehabilitation includes very good physiotherapy, and it should be done by dedicated physiotherapists. So he should exactly trained that what kind of physiotherapy to be done. And along with the rehabilitation, there's a called occupational rehabilitation therapy. So say the patient is working as a clerical job or he is laborer, so he should be back to the work because otherwise his life if suffering because of the financial reasons. So the occupational therapy as well as rehabilitation therapy is very, very important to get the patient with stroke back to the normal life.
And how typically the time duration is, how much time it takes to recover, and what factors influence that process?
Yeah. So mostly it is takes 3 to 6 months to completely recover. If patient does not recover after 6 months, the chances of recovery is very less. So the 6 months is the main duration. During that, the rehabilitation should be focused very much. Otherwise, after 6 months, in spite of good rehabilitation, chances of recovery become very less. So initial 6 months are very, very important for physiotherapy and for rehabilitation therapy. If you do good physiotherapy and rehabilitation, then definitely most of the patient will back to the normal life.
So recovery journeys, any which way is very difficult for any patient, but in stroke it is all the more difficult because you have
Yeah.
everything. So the importance of mental health support in that from the family, the caregivers, what role does that play?
Yeah, because it is a disabling disease, but it does not disable only your physical part, it also affects your mental part also. So, because say the patient is bedridden or patient is chair bound, definitely he requires support of the relatives or maybe the some of the friends, and and they feel that they are dependent on their relatives, and this feeling ultimately they develop the depression, severe anxiety, because they have always the feeling that they are dependent to the others, and that's why along with the physical disability, they become very much depressed, and sometimes they even don't perform any exercise. They don't perform. They don't even take the regular medicines. They say, "Oh, nothing going to be help," because of their severe depression. So in this case, the support with the family, support with a friend is very, very important. They should be mentally motivated. They can be recovered so that they can take regular medicines. They sometimes we have to give antidepressant medicine with the help of a psychiatrist. If they recover from the depression, the mental status is better, then the recovery of physical disability is also very less.
Absolutely. So can you share some insights about, how any new technology or therapies that are, helping stroke survivors to regain their lost abilities?
Yeah, so nowadays the robots are coming in a big way, and there's a lot of robotic devices are available for the rehabilitation, because doing exercise is sometimes very difficult, and even the physiotherapists are not going to helpful, so they require some of the new devices. Now, so there's a robotic machines are available which helps in your physiotherapy as well as rehabilitation for the early recovery.
Right. So, moving on to the last part of our interview, can you help us understand what are the current, status of stroke care, policies and infrastructure in India?
Uh, Unluckily, it is not good because we don't have dedicated stroke units in the hospital. So very few hospital in our country has dedicated stroke unit where patients are separately treated because they require special attention. If we treat in general ward or general hospital, the facility is not much of their treatment. So we require a lot of stroke units in our country at district level and even at peripheral level, so the healthcare is improved. But unluckily, this healthcare is still lacking in most of the uh, centers in India. It is only available in major centers in India. So it's definitely it's require good infrastructures for stroke care of the patient.
So, do you think that the advocacy efforts, which the organizations can take, the hospital providers can take, the government can take, will it effectively help in the stroke awareness and the ensuring that community is aware of what stroke is?
Exactly. The main problem with the stroke is the awareness, because even the most of the people are not aware what is a stroke, and they don't recognize their symptoms. As symptoms, I already discussed, there's weakness of one side or decreased vision on the one side, or difficulty in speaking. So the problem in the stroke is the diagnosis, because most people are not able to diagnose. Most of the people are diagnosed heart attack because of the severe pain, but in stroke there's no pain. So most of the time they came very late in the hospital because they don't know about the stroke. So the stroke awareness and stroke advocacy is very, very important, so they can understand what is stroke. First thing. Secondly, here the treatment period is very, very important. If patients comes in the hospital within window period, that is up to 4.5 hours, we give some drugs, which is called clot busting drugs, which dissolve the clot. So if the stroke is recognized early and was treated early with appropriate medicine, most of the patients recover. So that's why the stroke awareness as well as stroke advocacy is very, very important to the various organizations, to the social media, and through at the government level.
Absolutely. Any message that you would like to give about stroke? Any particular message that you would like to give?
So main message is fast. Fast means early recognition of the stroke. So the fast is basically these are symptoms of the stroke. So fast is facial deviation. There's a arm weakness. There's a weakness in the control of the body movement, weakness in the limb. So if you recognize these symptoms, and these symptoms should be recognized very fast, so you should reach the hospital as soon as possible. Because if you delay the treatment, even by 1 minute, you are likely to lose 20 lakhs neurons. So you can understand the severity of stroke. 1 minute loss in the treatment, you loses 20 millions of the neurons. So it should be treated as soon as possible, so the neuronal loss or the brain cell loss can be prevented and patient have very early recovery. So the message is diagnose the stroke at very early stage and treat it as soon as possible. And second thing is prevention is the key. 3 factors are very, very important: recognition of the hypertension, diabetes, and quit smoking.
Thank you so much, sir. It was great talking to you. We have also got so many insights about stroke,
Yeah,
and it's
that's why
lovely.
the advocacy really helps. And I think the message to the social media is very, very important, because people
Absolutely.
are very much not aware of these kind of symptoms. And that's why they remain disabled throughout the life. And it is not disabling to the patient itself, it is disabling to the whole family, because he may be earning member and it is very difficult to other family member to take care of that disabled people. So it is very, very important to diagnose as well as treat as early as possible, and as well as prevention of the stroke.
Absolutely, sir.
Yeah.
Thank you so much, sir, for participating and for giving your valuable time to us.
Thank you. Namaskar.